Morning. Today we're going to talk about healthy eating in Shadowville, making smart choices without a grocery store. Shadowville is a community that struggles with limited access to grocery stores and fresh food markets, a situation commonly referred to as a food desert. In these environments, residents often rely on fast food restaurants or small corner stores where food is highly processed, calorie dense, and nutrient poor. These circumstances create significant barriers to maintaining healthy lifestyles. Nutrition plays a vital role in health, influencing the prevention and management of chronic disease without reliable access to fresh produce and whole grains. Families may face long term consequences for their health and well being. In this education, you will find the importance of self care through nutrition in Shadowville, highlighting the health risks of poor diets, affordable alternatives available to residents, and strategies for illness prevention and management that empower individuals and families to take control of their health. Introduction to self care and nutrition. Self care empowers individuals and families to prevent illness. Nutrition is a key part of self care, which Shadowville faces unique food access challenges. Food deserts in Shadowville. Food deserts equal limited or no grocery stores. Residents rely on fast food and convenience stores. Health consequences of obesity, diabetes, hypertension. This directly impacts individuals and family. So now we're going to talk about self-care for health promotions. The reliance on low cost, high calorie food in Shadowville contributes to an increased prevalence of chronic illnesses. Obesity is one of the most common health risks, fueled by diets high in sugar and fat. Excess weight increases the risk of diabetes, a condition that can significantly impact quality of life and increase medical costs. Hypertension or high blood pressure is also prevented in communities with poor diets due to the frequent consumption of high sodium foods like canned soups, chips, fast food meals. Over time, these conditions lead to heart disease, which remains the leading cause of death in the United States. The connection between poor nutrition and these chronic diseases is well documented, underscoring the urgent need for community education. Understanding the risk empowers residents to recognize the importance of dietary change, even within the limitation of a food dessert. As we just talked about, illness prevention strategies, reduce salt intake. It helps prevent that will help prevent hypertension. If you eat balanced meals with protein, whole grains, and vegetables, portion control tips for families, affordable substitution to prevent diet-related illnesses. Illness management living with chronic conditions, diabetes, control sugar intake, portion carbs, hypertension, avoid processed foods, lower sodium. Heart disease, increase fiber and lean proteins. Family can apply daily self-care options. So looking at a practical day one meal plan, if you do breakfast, you can have oatmeal with canned peaches it's a good source. Lunch will be beans and rice with canned vegetables. Dinner, frozen chicken with pasta and tomatoes. Snacks, popcorn or fruit, simple, low cost, realistic for Shadowville. Okay. We're going to move on to family-centered self-care. Involve children in cooking and meal planning. Share meals to build healthy habits together. Encourage families to use SNAP if they need it, food banks, and gardens. Empower families. Small steps make big changes. So, from some affordable food substitutions, while food desserts limit choices, healthier and affordable options still exist if residents know where to look and how to shop wisely. For example, canned fruits packed in 100% juice are healthier than those packed in syrup, which contains large amounts of added sugar. Frozen vegetables provide essential nutrients and are often cheaper than fresh produce while lasting longer. Whole grain products such as brown rice, oats, and whole wheat tortillas can replace refined grains to increase fiber intake. Beans are an inexpensive source of protein and can be purchased dry in bulk to save money. Choosing water or unsweetened drinks instead of soda is one of the simplest yet most effective changes a family can make, reducing sugar intake and promoting hydration. These substitutes may seem smaller, but collective, they reduce the risk of chronic disease and improve energy levels. Promoting illness prevention and management, nutrition is central to preventing and managing illness. A diet lower in salt reduces the risk of hypertension and associated heart problems. Families managing diabetes can benefit from monitoring portion size and balancing carbohydrates with proteins and fiber rich foods. Reducing processed food intake and cooking simple meals at home allows individuals to control what goes into their food, lowering fat, sugar, and sodium content. Fiber from beans, oats, and vegetables can improve digestion support, health cholesterol levels, and aid in long term heart health. Illness management through diet is not only cost effective but also practical, as it reduces dependency on expensive medication and frequent healthcare visits. Self care practices that emphasize balance throughout eating give Shadowville residents a sense of control and resilience in the face of limited food options. For family centered self care, nutrition, education, and changes are most effective when the entire family participates. Parents who model health eating behaviors encourage children to adopt these habits for life. Simple activities like involving children in preparing rice and beans, choosing vegetables, or learning how to read nutrition labels can build lifelong skills. Sharing meals as a family not only strengthens relationships, but also reinforces consistent routines. In addition to families should take advantage of local resources. Shadowville residents can benefit from food pantries, anything that is helping with the government program, and community meal sites. These programs help bridge the gap between limited availability and nutritional needs, allowing families to make healthier decisions. So we're going to end this with Shadowville residents face unique barriers to healthy eating due to the realities of living in a food desert. However, by focus on affordable substitutions, family-centered self-care, and illness prevention, residents can take meaningful steps towards better health. Educational efforts are essential in empowering individuals with the knowledge and skills to improve nutrition and quality of life. Even small changes such as replacing soda with water or incorporating beans and rice into a daily meals can reduce the risk of chronic illness. Ultimately, self care and nutrition is not just about individual choices, but also about fostering resilience within families and communities. Through education and support, Shadowville can move forward towards healthier, stronger future despite its challenges. We're going to do a post test quiz. I want you to answer these 5 questions. Define a food dessert. Name 2 chronic health conditions linked to poor nutrition. Identify 1 affordable substitution for vegetables. Name 1 community resources in Shadowville. Create a simple 1-day healthy meal plan. Closing and takeaway messages. You have the power to promote your own health through self-care. Small, realistic changes prevent illness and improve well-being. Healthy eating is possible in Shadowville. Together, we can do it. And then there's going to be a couple of handouts that you're going to find at the bottom attached to this video that you can review. Just telling you things like, community education about where you can find food, the best way for meal preps. A couple of meals should be included in the handouts. The second handout is practical nutrition. It's just pretty much tips for families that live in Shadowville. And then the third handout is healthy eating. Just tells you different ways that you can help with your eating.